I'm starting to feel like people should have paid to attend today's space because the amount of data you are just sharing is very, very amazing. That with regards to national insurance, now I see why Rwandans are always looking good. Because I'm always wondering, these people come into Kampala, they're looking good. All the teeth are there, no ailment. And I'm like, what? Home the national health insurance, that's definitely something I advocate for. And as you were speaking, I actually thought about diaspora insurance as well, because yes, Ugandans might not have money, but our brothers and sisters who fly abroad actually have this money. And we have banks like Equity Bank, I think, having diaspora programs in Dubai, remittance of money. I feel like if they do sell health insurance in a diaspora where they tell them, you know what, if you have people back here, we can literally just have a diaspora health insurance where they are catered for. You don't need to just look for money every time your mom calls you, like, no, you're insured or something like that. That was really, really nice. As I was reading up on health insurance, so in emerging trends, some of the other emerging trends I actually fell on was PR. So this is PR and reputation management in the health industry. But the one thing I am seeing is in Uganda, it's like the biggest percentage of the health sector does not actually care about PR. People will die at their hospital, they will not release a statement, they will not even come out to, put out an apology or something. We've seen cases where patients are bounced and then they go on social media crying, they're like, oh guys, these people refuse to work on our relative, the relative died or something. And then PR stretches are way more past just attacking problems or solving problems, but you enter hospital, there's no welcome message. All the welcome message is in English, but most of the people entering this hospital actually, they can't read. So from a PR perspective, because this is also an emerging trend, out there it's big. It's really, really big. And I loved how Rocket Health, when the Will Smith saga, that slap, when they slapped Chris for making a joke about Will Smith's wife. So Rocket Health came out and said, oh, by the way, this is why Will felt like he should slap. His wife is suffering from this and this condition, and let us tell you about it. Because at that point in time, that was the topic, and they executed it perfectly well. So what advice do you have for brands that should actually are not tapping into the PR perspective? I mean, brands like our National Hospital Monaco, there's always a scandal every time, every month, every year, and yet we literally just move on, forget until the next scandal.
So, thank you. So I think from the beginning, I said the gap between the doctor and the patient has reduced, because the patients are not coming when they are grieving. They are coming with some basic information about their ailments. And when they come, they want you to explain to them, why are you taking my blood pressure? Why are you piercing me in this area to collect my blood? How many mils of blood I read on the Google that I'm supposed to, So people are more informed, and it calls for really professionals. And this is what we teach at the professional strategist of marketing and Datamine. One of the topics we teach is corporate reputation. How to manage corporate reputation. It goes to the image of the organization. People will choose a hospital because of the kind of image it has portrayed in public. And so you need a marketer. You need someone with professional skills who can be able to build that image. And that image that is not superficial. So the marketing will go even to quality improvement in the hospital. The person in charge of marketing of the hospital should be able to talk with the person in charge of quality provision. Measuring the metrics that matter for patients. Measuring metrics, simple metrics like what is the average waiting time for a patient when they come to reach the triage to when they see a doctor. When a marketer has analyzed that, he should be confident enough to do a strategy of how to reduce that. Because people don't want to stay longer. That is the person who will do a bad treatment. Can you imagine I spend 5 hours on the waiting line? Because that metric that has been measured, that speaks to the customer's experience, should be analyzed and should form strategy. You need a marketer to do that. We need a marketer to understand when we have given our people services, what kind of feedback are they giving to us? Are they signing kind of how do they call them? Where someone, is it a remark or something? giving a feedback form, about their whole experience at the hospital. Gone are the days where hospitals should be smelling.
Yes.
They're not the smelling. No, these days you reach a hospital and it's clean. And it's one of the emerging things, really. Because when you go to a pharmacy, you're as if you're entering a supermarket. Why? Because we don't want people to feel so sickly. You are sick already, but all you can smell is pus and injection and what have you. That speaks to the experience of the customer. If there is something that is stingy, you need a marketer to really analyze that. For us to improve the experience of our customers here, we need to reduce this stinginess. We need to make the home lively. If it is a pediatric clinic,
I think we've lost you.
Yeah? If it is a pediatric clinic, we need to understand when children come there, they want to be playing with balloons and toys. They don't need to come there and start crying or they're going to inject me. So all the people that are really going into that area of healthcare, you need to understand that you need a professional to assist you with really doing the strategy of how you're going to enter the market. I have seen people opening up pharmacies. I've seen people opening up hospitals. I've seen people doing all sorts of healthcare services, but without the marketing gist around it.
It's actually so funny how in the hospitality industry we ask for feedback for every client that comes to the hotel. The moment you get your email like this, even if you're in the hotel for 5 freaking minutes, we have to ask you, how was your experience? What's your experience? How was the parking lot? Was it okay? Because these are some of the things people are going to go on social media and complain about. And then someone's going to drag your hotel in the mud just because in the parking they didn't clean it. Like, really? So that's amazing.
Let me tell you about
something. I looked at it like that, but wow, that's an eye opener.
Let me tell you something more. What a health marketer, professional marketer would think about when he's doing a strategy for your hospital, for your health center. A professional marketer will look at what they call the customer journey.
Yes.
In this case, it could be the patient journey or anyone accessing services at that health service. He will look at what are the different touch points that a customer passes through to access the services. So, Piper, let me ask you a question, and you don't need to answer this. When your head pains, what do you do?
I take water.
You take water, first of all. When it persists,
I go get Panadol.
When it fails, so you go to the pharmacy.
Yes.
And get Panadol. When it fails,
I go on Google.
You go on Google.
Actually, the first thing I do is go on Google to first check why is my head paining. And then I'll get a bunch of explanations from WebMD. You have cancer.
WebMD, you mentioned that. Yeah. so really, these are the touch points of the customer. And if I am a marketer, and I know there are regulations as to how much advertisement you can do in the healthcare industry. But if I am a marketer, is to see how do I improve the experience of the customer's journey to access care from me. When they are Googling, how am I positioned on the search engine as a hospital?
Am I doing SEO? Do I have a Google?
What kind of content are my professionals bringing out? I'll tell you some of the examples that I think some hospitals are doing. I've seen some hospitals go on social media and present, yes, we have a new specialist, and that specialist is giving information of how people will feel. Someone will tell you that, for me, I'm an ENT surgeon, and I will solve problems like hearing problems, things that people understand. That is good content that places the hospital or the medical service provisioner as a thought leader in the industry. So when so when you are a hospital, you need to be known for your niche as a thought leader, and you must be able to develop content that people are willing and are seeing benefit from you.
It's unfortunate the space dropped off because I needed John to listen to that. When our first meeting with him, I told him, he asked me, Faizo, how do you intend to promote Datamine? And I told him, I want us to be thought leaders. I don't want us to just go and post a poster. Everyone does that. I told him, first of all, people don't even know what CIM is. You say CIM, someone's like, the one in Chibuli, are you talking about CID? I'm like, no, this is marketing. I'm talking about marketing. So the first thing I told him was, you know what? One, we are not going to market Datamine before we even tell people about CIM, because they have to understand, why should I go to Datamine? Because of CIM. Okay, what is CIM? This is how vast CIM is. But I'm not going to tell you, CIM is a university in the UK. No, I have to actually show you what that knowledge is. You have to understand that their thought leader
Yeah.
in this.
Yeah.
They're not even asking me to come and enroll in their school, but the fact that they articulate all these matters correctly. I mean, like this entire topic of today, it's like I'm in school. I have to get a book and write down notes. I have to get a book and write down because today, this month, I have to go to a hospital. Tell you have a market here.
I'm not just any marketer.
Yeah.
This is someone really who's a professional, who has taken professional training. And one of the centers is Datamine, where we train people, professional marketing. People that, so because you want to get return on investment of your marketer's work, so really get a professional. Someone who's calling themselves a marketer and is not really, you need to think twice before you can have an investment. Get someone who's professional at what he's doing. He knows the technical know-how of how to do things.
And the other trend that I'm not going to forget to talk about is ease of service, what you talked about.
Yeah.
And right now, in the villages, I haven't yet seen it, but in our hospitals here in Kampala right now, you can actually, before it used to be, give us your bank account, oh, this is a hospital bank account, go and pay in the bank. I remember back then. But now there are Airtel Momo codes, MTN Momo codes.
Sure.
Like you literally just have to see the code, pay the bill, get your drugs, and go away. Yeah?
I mean,
and then there's this other hospital I went to. They said, no, you can leave, your drugs will find you. I'm like, what do you mean? They're like, no, we already sent a border with your drugs, your package. They're already going to your workplace because we asked you point of delivery before they even started diagnosing you. So by the time the doctor was done, my drugs were already gone. And I saw why they do that. Because at that point in time, I couldn't say, no, I'm not going to buy from here. Because the drugs are already on their way to work. So I was impressed. I was like, oh my God, from a marketing perspective, this is brilliant. You made it easy for me. I can't even complain about the prices of the drugs anymore.
Yeah, and I think when you talk about that, it is really important to also look at some of the other trends coming up. So, like for the international NGOs, or the NGOs really, what they're doing to promote health, they're using things like chatbots, where someone can ask any question on a chatbot and there's an automated answer. There's a USSD, for example, even if you use it on your phone, *161#. It is a USSD where you'll be able to access information around your health, information around family planning, information around HIV. This is information. So really, I think many companies are embracing the digital channels to be able to reach to customers where they are and give them convenience of utilization of these services. Other organizations have also put toll-free telephones where you can call and be able to get information about a specific area. One of the areas is, for example, HIV self-testing. You can call, and even if you're in the comfort of your home, you will get information on how to self-test HIV, how much the kit is, and which pharmacy can sell the kit to you, and how to use it. So I think really organizations are using these some of these channels. The thing is, as an organization, you need to be on top of your game to make sure that you really don't lose out. Because if you think things are still the same, the way we used to do them when I was born, I think things have changed. And this is the time for you to have a digital marketer or a digital professional really to assist you on the same.
All right. Before we go off, let me before I actually ask you today's last question, because I feel like you really expounded a lot. So some of the other emerging trends I found out is artificial intelligence and automation, where brands are using 5G to operate people when they're not even on site. Yeah, that was amazing.
That's already in Uganda. I'll tell you an example. Go ahead.
No, first example.
So recently, if you check that Twitter handle over Dr. Diana Atwine, she was saying how she was launching a virtual reality training for emergency and clinical care practitioners. So people will not need to go to the US. If you're teaching someone how to operate on a person, you can put on your goggles and be able to understand using virtual reality, and augmented reality to be able to know how do I cut the body of a person, how do I do this. So really, these are advancements that we need to use. If you are going to explain someone's ailment, for example, in your hospital, why don't you give him virtual reality and he sees how his liver might be affected? That's virtual reality that we're talking about. It's already in Uganda. Dr. Diana Atwine launched it recently and is going to execute in terms of training healthcare workers using virtual reality. They don't need to go to the US. Wow, so it is right here.
All right, so before we break off, I'm going to ask you to talk about this. When I was researching, they also talked about how diversity in the workforce is an emerging trend, and how way back then, nurses, residents were mostly ladies.
Yeah.
And the very, very senior people were men.
Yeah.
Doctors, the surgeons were all men.
Yeah.
But right now, things have changed. You go to a hospital, at the reception, the nurse, it's a man, he's a man.
Yeah.
And then the person operating on you is a woman.
Yeah.
I'll tell you a scenario. In my Essex, I had a condition. It's called testicular tissue.
Yeah, tissue. Yeah.
Yes, so they cut your testicles and all that.
Good.
But that was the scary part. But the most scary part was laying on the table, and then I find out it's women operating on me. So they're asking me, so how is the pain?
Yeah.
And I'm still trying to process the fact that women I don't know are going to open me and see everything.
Yeah.
And I was lost.
Yeah.
How is the pain? I think that anesthesia had already hit me. That's the last question. That's the last question I remember.
Yeah.
But if you could talk about diversity, because I feel like this is something we also need to highlight and let people out there know that if you find a female surgeon, if you find a female doctor, it should not be a surprise. That's an emerging trend. You should literally welcome it.
Actually, I think I like that fact, and really I like the fact that the diversity and inclusion agenda is running all over the world, really, and people are starting to question how many women are in leadership in the organization, how many people of certain sexual of the alignment, how many are you stereotyping people based on their sexual alignment? It is a real emerging trend. Well, the one from nurses, I really think is emerging because my dad is a nurse. Can you imagine? My dad is a nurse. Yes, and I was born when he is a nurse. He has been a nurse for the longest period of time that I know. And really, but you see, he does his work diligently as a nurse. Yeah, he grew from the lower levels over, doing nursing aid work. Now he has a master's degree in nursing. You can imagine. So really, I mean, this whole notion of stereotyping sex with profession should really be something of the past, and not only in the healthcare industry alone, but also in all the industries. And you need people who really can help you push that agenda. That someone should be comfortable with a female nurse, working on him. Should be comfortable, and you need to showcase how many female nurses, for example, have done, or female doctors have done amazing work. We have lots of female professors at Makerere who are doing amazing work. We have heads of departments, for example, at the Casa Institute, ladies doing a lot of amazing work. So really, it is a thing of the past to stereotype, people based on who they are. I think we should focus more on what they are able to do. They are professionals, they can do it. Even in the marketing industry, please hire the ladies, they are professionals. Hire the men, they are professionals.
I'm going to stop it from here because I feel like we have really given out our loans. We need to be paid. We need to be paid. But before I close it off, for those who are watching, this is the Marketing and Datamine podcast, and we've been talking about emerging trends in healthcare marketing. Festo, I'm going to let you give your parting shot before I give mine, so please share your parting shot before I close this off. Yeah,
so thank you, Piper, for this, for giving me the opportunity to really talk to the people. I think my parting shot is to say marketing is not distant from healthcare. In healthcare, I think we've talked about the relevance of how marketing really comes in to connect the gap. So marketing is here for us, and the good thing, we're also giving a solution that Datamine, an accredited study center for chartered digital marketing, will give you the professionals that you're looking for to be able to give value to your investment. So in non-government organizations, government of Uganda, hospitals and medical centers, you need professional marketers to push the agenda of success on your ROI. Thank you.
Well, for me, my parting shot is it was amazing having you here. I've really learned so much, so much. I didn't even think marketing was that deep in the marketing sector. I thought it was just a thing of the movie. You watch Residency and you see all these people flashing around things. But for all those that are watching this, please take this opportunity to actually do something. If you're in the health sector, you're in insurance, you're in advocacy, NGOs, government, please take this opportunity to actually do something and hire someone experienced to get the job done. Vaccines should not get things like vaccines.
Vaccine hesitancy.
Exactly. Things like vaccines should not expire. when you would actually just hire marketeers to push this, yeah, you should not push vasectomy down people's throats without finding out what are these men even okay with something like this. This is all marketing in the health sector.
Yeah.
So, Festo, thank you so much. It's been another amazing episode of the Marketing and Datamine podcast, and yeah. Until
Thank
next
you.
time.
Thank you. Thank you, Piper.